I will speak about an ocular melanoma diagnosis in childhood. So the incidence of uveal melanoma has been looked at in different age groups. And this is a graph from Dr. Singh from the United States showing the rate per million and the different age groups all the way up to the early 80s. And you can see that in males and females, the disease occurs more frequently in older, starts in kind of middle age and older individuals. So it's quite rare to have melanoma in this age group, and even more rare in the very young. So in this particular data set, there weren't any in the very young ages, but it is known and it is described. What kind of risk factors will we look for in a young child or an adolescent with possible melanoma? Well, Caucasian race, if they had nevus of Ota, which is a excess pigmentation in and around the eye, a history of other tumor type syndromes such as neurofibromatosis type 1, the BAP1 tumor disposition syndrome, and familial atypical mole and melanoma syndrome. So how common is it? Well, a Polish study showed out of 800 uveal melanoma cases, only 1.4% were aged less than 20 years old. And then a Finnish study from Dr. Al-Jamal and Dr. Kavela studied 1,185 uveal melanoma cases, and 1.3% were less than 25 years old, and 0.6% were less than 20 years old. And this paper also said that females were more likely to be affected than males. But obviously, we're not looking at many cases. Uveal melanoma is a rare disease anyway, and this is a very, very unusual subset. And Dr. Shields from Philadelphia described uveal melanoma in children and teenagers. And over the years, and this is a big center for ocular oncology in Philadelphia, 122 children were managed with uveal melanoma at the Philadelphia Center at Wills Eye Hospital. And 53 or 43% were male, and 69 or 57% were female. Where does the melanoma occur in children? Well, 25% in the iris, 67% in the choroid, and 8% in the ciliary body were the main foci. The 5, 10, and 20-year estimates for uveal melanoma-related metastasis were 9%, 9%, and 20% at the 3 time points for the children. And when they compared that to all ages, it was lower. So in all ages, it would be 15, 25, and 36%. So uveal melanoma in children has a better overall prognosis. It can rarely occur in the first 2 years of life. Certainly I, in my work in London, do pediatric ocular oncology, and I have managed some young cases of melanoma, including in this age group. And in the world's literature, there are 13 reported cases, which were all reviewed in this publication from Jordan. But 13 cases reported worldwide where uveal melanoma was diagnosed in the first 2 years of life. And very occasionally, it can be at birth that a child has a tumor when they're born. There were 7 boys and 6 girls, and the median age at diagnosis was actually about 7 months. And in this group, all affected eyes were removed. They were too advanced for any form of radiotherapy. The European Ocular Oncology group published a paper, again, Dr. Al-Jamal, collected all this data from 24 ocular oncology centres in Europe, and the UK centres were part of this. There were 299 patients within this study. 114 were children classified as being under the age of 18, and 185 were young adults. And the melanoma related survival at 5 and 10 years was 97 and 92% for children, and 90% and 80% for the young adults. And this paper found that males had a more favourable survival than females amongst the children, and ciliary body involvement and cell type were not associated with survival, which is different to adults. So if I had a child with melanoma, what kind of treatments are possible? Well, in a small or medium melanoma, you could think about radiotherapy. I would try to do plaque brachytherapy if I could. We have a lot of experience of doing plaque brachytherapy for other pediatric eye tumours, such as retinoblastoma, which is a rare type of eye cancer that occurs in babies. Even more rare tumours called a medulla epithelioma is often treated by plaque brachytherapy. So if the tumour were amenable, then I would try to treat with plaque brachytherapy. Proton beam, a lot of facilities that give proton beam radiotherapy require the patient to be upright. So you could do that in a child who's able to sit upright and fixate and follow instructions, so kind of 8-9 years old upwards, but anything younger than that, that might be a challenge. And then the other types of treatments are possible. Very advanced cases would probably require removal of the eye or enucleation. Melanoma in children can also affect the conjunctiva or the surface of the eye. And in this review, looking at children under the age of 18 years old, there were 32 patients in the world's literature who developed conjunctival melanoma. 18 were males. Most of these affected individuals were white. All of them were managed by excisional biopsy of the tumour. And this paper, and I agree with this, said that there were better outcomes in specialist centres with appropriate surgery, where the tumour is handled in a particular way to try and avoid the dissemination of cells on the surface of the eye. So ocular melanoma is rare in children. It can occur in any age group, even very young infants. And the treatment has to be tailored to the clinical presentation. The counselling in this situation is of the child, and that has to be in terms that the child can understand, so age-appropriate counselling. And because in other tumours such as retinoblastoma, there is experience of doing this, it can be done, even for treatments such as radiotherapy or enucleation of the eye. Obviously, counselling the whole family is very important, counselling the parents, what to expect and the kind of treatments that are possible and the aims of treatment and so on. All very important. And also siblings are very important. And I certainly work with a charity called the Childhood Eye Cancer Trust, which mainly supports the families of children with retinoblastoma, but have supported some of my patients with other rare ocular tumours as well. Thank you for your attention.